All right, as everyone's joining, we'll get started here in just a couple of minutes. We have some housekeeping slides that are playing, and then we'll start shortly. They do not, however, appear to be automatically advancing. All right, well, we are adaptable here. I can count to 8 over and over. Oh, they stop advancing if I click off onto the Zoom. Got it. Operator error, my apologies. As everyone's joining, we just have some housekeeping slides that are being displayed now. We'll get started in 1 more minute. As everyone's coming in, I just wanted to draw your attention to a couple of announcements. Today at 3 p.m., be sure to visit our exhibitors in their individual exhibit booth Zoom meeting rooms. Find the sponsor tab in the navigation bar and select virtual exhibit hall. Come by and meet the sponsors who support our conference. At 3:30 p.m. Eastern today, there's a Careers and WASH virtual networking event for young professionals. It's happy hour and networking in one event, and now they start going automatically. Oh man, I'm getting all the bugs out right up front. Tomorrow, the last poster presentation begins at 3:15 p.m. Be sure to view the posters and talk with presenters in individual Zoom meeting rooms. Look on the agenda tab, and you can find the all posters option there. Oh, there's the, all right, hopefully everyone else has better PowerPoint experience than I did. So now we're gonna start our verbal presentations. Let me stop sharing. All right, so the session's theme is on culture and diversity. We have 2 great speakers for you today. I wanna start by introducing Natalie Exum from Johns Hopkins University, an assistant professor there. She's going to be sharing her presentation on women's sanitation needs in their workplaces, a mixed method study in Mukono, Uganda. Natalie, whenever you're ready.
Great. Can everyone see my slides?
Yes.
Excellent. Hi, I'm Natalie Exum. I'm at the Johns Hopkins Bloomberg School of Public Health and assistant scientist, and I'll be presenting women's sanitation needs in their workplaces, mixed method study in Mukono, Uganda. And this is one part of a larger women in the workplaces study that has a sanitation and a menstrual hygiene component to it. And I encourage you to come to the next session where my colleague Julie Hennegan will be presenting on the menstrual hygiene side of the work. And so before I begin, I just want to thank the Osprey Foundation for their funding to make this study possible, and our amazing colleagues at the Makumbi University School of Public Health, Simon Kibira, Justine Bukenya, and Fred Makumbi. So thank you to them, and let's get started. So why sanitation and working women? Well, I think Melinda Gates said it best when she said, simply put, when money flows into the hands of women who have the authority to use it, everything changes. And so here you see a roadside market, maybe on the way to a peri-urban or an urban center, and most likely women, and some, usually low-income women, are here selling food or items or clothes, and often they're making a salary not just for themselves, but for their family and their children. And so putting a dollar in a hand of one of these women can actually change everything. And so here's our motivation for the work that I'll present. Safe, convenient sanitation is necessary for economic productivity when working outside the home. So think about bus stations and city centers and that roadside market that you saw. They're often places where people are earning salaries, and sanitation is key to them being able to maximize that salary. And so also, the Joint Monitoring Program has done an amazing job of monitoring access to wash across the world, and specifically for sanitation as well. Sanitation has been characterized very well in households, and now more so in schools and in healthcare facilities, but we still have a knowledge gap on on sanitation in public toilets and in workplaces, and how it impacts participation in the workplace. And so for this work, we are aiming to empower local female workers and decision makers by providing an evidence-based assessment of sanitation needs for working women. And these are our research questions. So how do women experience sanitation at work? How are they managing their needs in the workplace? And how do they make decisions and interact with the sanitation infrastructure that's provided for them there? What are the consequences of the current situation, of their current sanitation situations on their participation, health, and well-being at work? So what do they perceive are the impacts that it's having on their participation? What do they perceive are their health and well-being consequences that they attribute to both the workplace sanitation and menstrual hygiene? And so for the Women in Workplaces study, it was a mixed methods, equal status, sequential exploratory study to understand sanitation and menstrual experiences. And if you're just joining us now, I'm going to be presenting on sanitation, and my colleague Julie Hennegan will be coming up in the next session, so stay tuned for her to really expand your mind about menstruation in the workplace. And for this study, we visited 10 eligible markets in the Mukono district in Uganda. That's the district just outside of Kampala, and as anyone that's been to Kampala knows, there's just massive commuters going into Kampala during the day. And so we wanted to use Mukono as this way to illustrate that commuter dynamic potentially. And so went to markets that were operating up and running more than 8 hours a day, 3 days a week. We went to geographically close government healthcare facilities and primary schools, and did this with qualitative work first, in-depth interviews with 35 individual women of menstruating age, and then use that qualitative work to inform the development of our quantitative surveys, and also to these observational facility checklists of the sanitation provided on site at that workplace. Went to 300 women for that, again, mostly focusing on market women. We will come back and do our focus group discussions to bring our findings to these women once COVID restrictions allow. So this is the main conceptual model coming out of that work. How do women manage and experience their sanitation needs at work? And so we see these internal kind of personal domains and external environmental domains that were, and we'll get into those later, that were really at tension with how women chose to strategize to meet their needs. And the 5 main buckets of strategies were they were restricting themselves, so actually holding in their themselves, or restricting the amount of liquid they would intake or food they would intake, using another facility other than the one provided by the market, using a bucket if they had that privacy, to be able to use a bucket to urinate and then dump it out later. If the facility didn't have what they needed, they were bringing their own resources, or they could negotiate with attendants and either go on credit or negotiate a lower price. All of these strategies having an impact on their health, well-being, including kind of anxiety or discomfort, and also on their financial stress. So let's get into these 2 kind of domains at tension. One was the external environmental. And so the 2 main categories that came out of that were cleanliness and cost. And so some women were saying that the stench was just so bad, they would walk in and they'd have to walk out and either hold it in or find somewhere else to go. And 57% of women reported the workplace facility was not consistently clean. And then cost was a big factor for women too. Almost every woman knew exactly the price for the market facility without hesitation. So it was a big thing in their lives. And so this woman was saying that for a long call, meaning defecation, if she didn't have the money to pay for the 300 shilling facility, then she would use the public facility, which was cheaper and less clean at 200 shillings. And so 59% of market women said that they were paying to use the sanitation facility. And then of those women saying that they paid, an average of 18% of their income was spent on the sanitation facility. That was a bit skewed to the right. 12% was more than median, but again, quite expensive. You or I are not spending 12% of our income on our sanitation at work. For the internal personal domain, there was strong fear of illness when going to the toilet. So this woman was saying, these are squatting toilets. I can't squat, I may get an infection. And this fear of vaginal infection came out very strongly in these qualitative interviews. 50% reported having a UTI symptom of burning during urination in the past year. And then the other category that came out of this personal domain was the women really felt a strong need to do genital washing at their facility. And so you see these stored water buckets that are provided there, and women often said that they would be bringing water with them to wash after urination, but certainly after menstruation and defecation. And so you find women often compensating if that wasn't provided for them there. Now, the two main strategies that came out of the qualitative work that women were using to meet their needs was restricting themselves and also using another facility. And so here one woman is saying it's more of a money thing for her for why she's restricting. She wanted to save money, so she reduced the number of times she went there. So she could have been reducing that by not drinking or eating as much, and then also just holding herself in. And so 59% of women reported delaying urination at work, and then 32 said that they were withholding intake of liquids. For other facilities, one woman said that here, she's saying, a neighbor just after the market fence, I use her toilet because the other toilets are too far away. So distance was an issue for this woman, not wanting to leave her stall for too long. And so in the quantitative work, 45% of women reported urinating somewhere other than the workplace facility, and 60% said that they were defecating somewhere else. Now, this had consequences on these women's lives. And so financial stress and health came out strongly. And one woman here is saying, I may go 3 times in a day and you may pay. So the expense is high, but you must clean up to maintain proper hygiene. And so this woman has a standard of cleanliness for herself. That's difficult for her to meet because of the cost of the toilet, but most likely, or what's coming out here is that she's saying that she's willing to take on the financial stress because she has a standard of hygiene. And so 53% of women reported stress or worry that they wouldn't have enough money to pay for the sanitation facility. And then for health, we have someone saying, yes, it affects you. If it's dirty, it affects your health. You will contract diseases, which in the end will affect your health. And so some women were saying, for health, for diseases. Other women were saying, I'm probably going to get bladder damage because I'm holding this in for so long. Some women were working up to 14-hour days. And so doing that over time can potentially even damage your bladder. And just from the quantitative work, 65% of women were saying that they had consulted a healthcare provider about symptoms in their genitals. And so this idea of vaginal infections was very, very much so on the front of women's minds. And just to wrap up here, women used a range of strategies to meet their sanitation needs in the workplace. There was this tension going on between their internal personal needs and what was provided for them at the facility itself and that environmental domain. And then importantly, I wanted to say there was a strong willingness to pay for clean facilities for women. So these women were not making a lot of money, but paying 200 shillings to use a clean toilet and to have an attendant there who was replacing the toilet paper and refreshing the water and ensuring the woman before her had cleaned up before was a really strong desire for these women. And so that is worth mentioning here. But there were difficulties managing their sanitation needs, and there were these perceived consequences on their life for health, well-being, and these women's finances. And just to close here and say thank you to our amazing numerators and our co-investigators at Makerere University to bring out all these rich experiences. Happy to take your questions on the Pathable website in the chat, by my email here. We can have this discussion over Twitter if you prefer. But just to say, our next steps are to bring these findings back to the women in the Mukono district and the marketplaces, and then to modify our survey methods perhaps for other contexts, because these were this was exploratory work. And thank you again to the Osprey Foundation for giving us the opportunity to do this work and do something exploratory and new. So happy to take your questions now. Ben, I'm not looking at the Pathable site, but if you are.
Can you hear me? Sorry, did I just do a wrap up for like 45 seconds and nobody? Okay, great. Love technology today. So I was going to say thank you, Natalie, for your great presentation. We have about 5 minutes for Q&A now. There's a few questions in the Pathable chat, but if anyone else wants to go ahead and put a question there, we can go through as many of those as we have time. So the first one was from Sean. He said, are some of these alternate options opening up side markets, i.e. the neighbor charges a small fee for people to use the toilet?
Yeah, great question, because it was so common. So a lot of the neighbor toilets were not charged for. And so it was often a woman's social network and her social resources that allowed her to kind of have those opportunities open up. We found younger women or women who had been in the markets for very long didn't have that option open to them.
Yeah, and then so Rick Johnson has, I guess, more of a comment than a question, really. It says, great presentation, paying 12 to 18% of income for accessing sanitation in the workplace is shocking, which I think is a good word to use. Yeah, I don't know, do you have any comments on that finding or thoughts about that?
Yeah, so women would often say, I can't go to use the facility until I earn for the day. And so a lot of times, you really saw the busiest time at those market facilities when we were saying the line was so long right around lunch, because I think women would hold themselves for so long until they could get customers to pay. And so I think I'm now hypothesizing here on this, but I think women would come, they earn for the day, they go home, they probably put that money somewhere else, and then they start basically with zero the next day. And so they're not earning that much. And yet they have to stay clean, right? Some of these women are actually serving food and working in restaurants. And so the cleanliness for them to be clean is essential. And so that cost is, and for them, is probably just the cost of doing business.
Yeah, which is, really unfortunate. There's such a demanding payment on them. There's a question from Darcy Anderson. Did you get a sense of how much influence women have to improve sanitation conditions at their workplace? Clearly, it's a major issue, but also appears to be a major income source for workplace owners and operators, which might be a barrier to change. So how do you go about improving those conditions?
What a great question. Thank you, Darcy. So, women were really good at figuring out how to make it work for themselves. And so someone would go with a plastic bottle of water with soap in it that they would take themselves. Women would be bringing the toilet paper that they preferred, because the toilet paper that they were providing, they only got 2 pieces and it was so thin. And so I think a lot of the ways that women were compensating for it were by washing the slab themselves before they got there if it wasn't clean enough, and also just bringing what they needed for the toilet facility to be up to their standards. And if the odor was too bad, then they just, I think, dealt with it. A few women said that they just would go home even, I think. And so a lot of women were actually dealing with it by just going home and then potentially losing wages from that time lost.
Okay, yeah. Okay, questions are pouring in now, so I definitely can't get to all these, but Natalie, if you can go to the chat after and answer some there, and certainly afterwards. So a couple that jump out, I think. Kelly Baker asked, were any of the women accompanied by young children? If so, did that change their decision making?
Yes, and young children, you had to pay more for them. And so, the children would, they kind of said they were off doing whatever they were doing. And so other women were reporting that the children were the ones making the marketplace dirty, that they were the ones to more likely be openly defecating or urinating. And if it actually was a point of tension, because women would kind of look down on other women for bringing their children, allowing them to do that. But some women just, after school, their children had to come somewhere. And so if they did, they were using the sanitation facility, they were paying more for those children.
Interesting. So there's a bunch more questions that I'm going to summarize a couple of them and have to skip over a few of them and just ask, so what's potentially a next step here? What sort of private sector or regulatory or further research or that sort of things are you looking into?
Yeah, I think most importantly for us is to bring these findings back to the women, because what we saw coming out, we want to make sure is reflective of their experience. And then second is really bringing this to the Mukono district authorities, because the ones who are providing these sanitation facilities are often vendors that then contract attendants, and so there is a private sector dynamic going on here, but there is influence from the district authorities and whoever is administering the markets. And so we want to share this information with them too, potentially, because because women are willing to pay. So that for our specific study, but we do have interest to expand these survey methods and look at this in other contexts and in a larger sample size to really say for women of after they're out of school, how do they become economically productive and provide for their families? And this really may be 10% of their income could really do a lot in terms of providing for their families.
Great. Thank you so much, Natalie. If you want to switch over to Pathable and answer some of the many questions there, I'm sure people would greatly enjoy it. Let's see. Okay, we'll switch over now to our second presentation. So now we have Kathleen O'Reilly, who's a professor at Texas A&M University. She is going to be presenting on audio diaries, a novel method for WASH-related stress research. So Natalie, over to you. I'm sorry, Kathleen, over to you.
Thanks, Ben. Good morning, good afternoon, good evening for all participants, wherever you happen to be. Let me begin by drawing your attention to the names and institutions of this multidisciplinary team that has collaborated in various configurations in the past and on the research that I'm about to discuss. Previous studies have identified both physical and psychosocial forms of stress among newly married women due to inadequate WASH access. In addition to identifying its forms, stress research can be enriched through contextual embodied accounts that are captured immediately or shortly after stressful social or environmental interactions occur. So audio diaries offer an opportunity to access situated data over a duration that is longer than a researcher could be present. Additionally, audio diaries may enable the disclosure of deeply private information, while at the same time giving participants maximum control over their responses, especially since recordings can be deleted before they're returned to the research team. So what are audio diaries? Using audio diaries means asking a limited number of participants to keep a daily diary using a voice recorder over a set number of days. Typically, participants are given prompts in the form of questions or topics that they're asked to respond to. And because they usually produce a large amount of data, a small sample size is the norm. They're analyzed similarly to other qualitative data collection methods like iterative independent coding and thematic memos. In prior public health studies of stress, audio diaries have provided rich data sets of participants' everyday practices and their interactions with their physical and social environment. And these have included the detailed reflections of adolescents who were HIV positive regarding their feelings about their status and the emotions that the necessity of maintaining secrecy produced. However, making the recordings attracted unwanted attention, and participants struggled to keep recordings private. In this particular study by Bernays et al., no adolescents who made recordings in phase 1 agreed to continue to make them in phase 2 for these reasons. In a study of breastfeeding mothers in the UK, some women made their recordings while breastfeeding. So their recordings captured their immediate experiences, as well as the multiple and contradictory emotions that they felt over the duration of the recording period. Some limitations included women reporting feeling anxious about the quality of their recordings and the rarity of participants finishing a full set of recordings. So these are just a couple of examples of the advantages and limitations from the body of work on audio diaries. You'll find a bibliography at the end of this slide deck that you can refer to. Most audio diaries, like those I just discussed, are supplemented with one or more qualitative or quantitative methods. The audio diaries methods limitations include low completion rates, entries quality being participant dependent, and the inability of the researcher to probe at the time of recording. So for these reasons, audio diaries are seldom used as a standalone method, as you can see in the highlighted column, based on the work that I've just been referencing. So I'll spend the rest of this presentation on the feasibility study of an audio diary research protocol we piloted in a rural Indian context where many women are illiterate. We were optimistic that it would be feasible, so we additionally wanted to understand how best to implement the method to generate the most useful data. So we conducted the pilot in anticipation of a future study in this same rural Indian context that will identify dominant forms of WASH-related stress, corresponding coping strategies, and mitigating factors for newly married pregnant women. This table shows our project timeline over 3 weeks in February of this year. Our goal was to recruit 3 women who were pregnant and without a toilet at home. 15 women were approached in 5 separate villages. Finding women who met these criteria and who agreed to participate was a time-consuming process. In week 1, participants were introduced to the project, trained on the prompts and the audio recorders, as you see in this image on the right-hand side, and they were asked to make 5 entries over the coming week. Prompts were given in both written and pictorial format. And the field team followed up with each woman after a few days to check that women were able to successfully record. In week 2, the week 1 recordings were collected and field staff asked women about their experiences with the audio diaries. Then they were given a new set of prompts for week 2, and these images that you're looking at are some of the pictorial prompts that were distributed and explained to the participants. As part of this pilot, women were asked open-ended questions about everyday practices. A slightly different approach was taken regarding the prompts in week 2. After the prompts were explained to the participants, the field teams asked women to explain the prompts back to them so that participants could demonstrate how they understood the prompts and to help them remember the meanings of the images. Women were also encouraged to seek help if there were difficult words in the written prompts that they wanted to understand. And because week 1 recordings were so short, women were also requested to speak for longer than 1 or 2 minutes and to record more entries. They were asked to speak specifically about each moment and to give more than the briefest of answers. And this image to the right is the recorder that each of the 3 women was given. This summary table shows the number of days and duration of the recordings over week 1 and 2. And you'll notice that women recorded for more days and total recording time was longer in week 2. This is due to participants' increased understandings of the prompts and the specific request that we made that their recordings be more detailed. In the rural context where cell phones might be common, but recorders are not, and literacy seemed like an initial barrier, The time spent with participants to familiarize them with the device and the goals of the pilot was necessary. After women understood and had spent some time using the recorders, regular recording was not an issue. So to turn to our findings, the average number of minutes over the 2-week period that each woman successfully recorded was 27 minutes per week, supporting the feasibility of audio diaries for producing detailed data in rural India among a population with low educational attainment. In exit interviews about their experience, women expressed that they enjoyed talking into the recorder and they enjoyed sharing with others that they were participating in the study and showing them the recorder. Overall, we identified some barriers to participation and modified our protocol to address these barriers. First and foremost, recruiting needed to happen when all family members were present, especially husbands, to ensure acceptance of the audio diary. And second, we learned that pictorial prompts generated more detailed information in contrast to the short yes or no answers that we got when the written prompts were used. Our pilot of audio diaries also revealed some logistical problems. First, recruiting and training was time intensive. An entire day was spent finding women who both met the criteria and were willing to participate. Initial training of women on the recorders took anywhere between 20 minutes to an hour. Second, meeting women at prearranged times to collect the recordings proved difficult as women's schedules changed and field teams weren't notified. Better contact by mobile phone might reduce this problem. We gained insights into women's everyday lives and familial relationships that generated stress, especially during the midterm and exit interviews with field staff. In answering questions about their experiences making the audio diaries, women expressed the reasons they had difficulties in making them, including their household responsibilities and a lack of childcare support. Our pilot indicates that audio diaries are feasible in a rural Indian context where women have low levels of educational attainment, and that they can capture data on women's everyday experiences in situ. While the recruiting and training process on the prompts was labor intensive and required follow-up visits, the midterm and exit interviews also generated useful data as participants shared detailed information about their lives and stressors when discussing their experiences of recording the audio diaries. When used with other qualitative methods, audio diaries offer a little used opportunity to collect participants' practices, feelings, and reflections in their immediate social and physical environments. So thank you for your attention, and thanks very much to the KHPT Central and field staff for their work on the implementation of the pilot.
Thank you very much, Kathleen, for that presentation. We have some questions starting to come in the chat that I can direct to you, but anyone else, please feel free to add questions and we'll get to as many as we can. We'll go for the next few minutes here. So one that's especially near and dear to my heart from Kellogg Schwab is, we've seen some technical challenges at UNC. Are there issues with the recorders or recording quality due to background noise, accents, other sorts of concerns?
So was that a problem? Is that the question?
Yes.
Okay. According to the field teams, no, that wasn't a problem. But in the literature, one of the problems that has arisen and could in our future study was the capture of voices of those who were not consented to participate. And in the Indian context, that's entirely possible, but it wasn't something that came up in this pilot.
Okay. Sean asks a question, says, audio diaries seem like a great way to capture immediate feelings, which often fade when we reflect later. They also might be time consuming. Are participants generally compensated for taking part, or how do they feel about that aspect?
Mm-hmm. Well, they are time consuming, and it's one of the reasons why there's attrition. In my review of the literature, participants have not been paid for their participation, and we did not pay women in this small pilot. At the moment, in the future study, we don't have plans to do that, but we do recognize that we're asking women to set aside time when they have many household responsibilities and childcare.
Mm-hmm. Great. One I wanted to just ask, building on that, the first part of his comment, actually talking about immediate feelings rather than maybe what we reflect on later. So are there strengths and weaknesses of this method that would lend it more towards certain kinds of exploration, certain kinds of behavior where that in the moment, maybe more initial reaction is actually what you're looking for, or maybe contexts where this wouldn't be a great tool to explore?
Mm-hmm. Well, one of the advantages, of course, of audio diaries is if participants have that opportunity to record immediately or immediately after an event has happened, and capturing those feelings and the experience without the filter, the processing, the development of a narrative. Which is one of the things that we see, of course, in interviews that are happening after the fact. However, if audio diaries are recorded after the fact, say later in the evening, hours after it has happened, it doesn't mean that women aren't going to express information that they wouldn't ordinarily express in an interview. And within the literature, this has a lot to do with that immediate in-person experience of responding, reactivity to the presence of the interviewer. And I think we have some sense of what that's like during COVID, when we're not always talking to people face to face.
Yeah, interesting. Okay, a couple of more nuanced questions on the methodology here. So one is about the cost of data collection via audio diaries compared to interviews or focus groups, or other sort of more frequently used qualitative approaches. And then also, were there reports of resentment or disapproval from male partners, household members, others, any kind of feedback like that?
Mm-hmm. So to answer the first question, yes, it's expensive. Even with a small number of participants, there is a lot of transcription and translation, training time, follow-up time, downloading time. So because of this time intensiveness, it can get very expensive. Again, even with a small number of participants. So that is definitely a factor to consider. Regarding resentment, what we found, and as myself and others who work in the Indian context have also found for other forms of participation in research projects, is that it's key to bringing in all male household members. And in this case, specifically husbands who might not be on site at the time of the introduction of the project and the request for participation. And what was done was that the field team simply returned to that household to speak with the husband. Once the introduction and full explanation happened, we did not get reports of resentment from male family members.
Okay, great, very interesting. Sorry for those in the chat. There's lots of questions coming in. Kathleen, maybe you can look at it afterwards and make sure to catch any that I've missed. There's a couple of questions again on feasibility. So Allison Parker asks if there are contexts where you can imagine this not working, saying she knows it's hard to generalize, but were there aspects of this context that made it more feasible? And then another questioner earlier also asked about, do these women have experience often using mobile phones or have access to phones?
Mm-hmm. So to answer the first question, it's key that participants in an audio diaries project have the ability to record in private and to keep the recordings private. And ethically, I think if that cannot be guaranteed, then the researcher is in a bind and is going to have to make the right choice, which is not to use this as a method. So I think in any context of very sensitive topics where there is a chance that the recordings could be listened to by someone that absolutely the participant does not want listened to, then you have to rule it. You have to rule it out. And the second question I've forgotten.
About if women here had access to cell phones. I think maybe that's so familiarity with the technology sort of question.
Mm-hmm. We purposefully use very simple recorders, and there are cell phones in this area, but the technology wasn't necessarily parallel.
Mm-hmm.
What the field team found in the second week was simply that greater familiarity led to longer recordings over more days. We haven't dug into the data far enough to know, exactly how much cell phone experience translates into ease of use of the recorder. But I think in any case where there are low levels of educational attainment and cell phones are not ubiquitous, then there's going to be a serious time commitment in terms of teaching the participants how to use them and how to use them easily.
Okay, great. One more question from me as we're about to run out of time is the question I always wish that I get as a presenter is, so what's next? Either methodologically or with this data, are you going to do analysis or is this just for feasibility?
Mm-hmm.
The floor is yours.
Okay, well, the next step is to get money to do the big study. But we are writing up this research to publish in qualitative research methods where we're able to dig in a little bit deeper about what women said in the first week and what they said in the second week, and be able to make some more connections between how women use the recorders in both settings and comparing those with the interviews and the overall process. So in short, we're looking to write up a process evaluation to discuss this method in this particular context, because this is one in which it is underused.
Great. Thank you so much. I think we'll stop there. We have just a few minutes before the next session, so people can take a break. As was mentioned earlier, there's a sort of a part 2 or a counterpart to the earliest presentation in the coming session, but in general, we hope you'll continue in the culture and diversity track. I'm supposed to spotlight my video, so you're looking at me, not watching Kathleen nod along. I'll figure this all out by the time the week's over. But thank you all for coming. Yeah, these are topics near and dear to my heart. I hope that if any of you weren't able to catch Aaron's opening statement and the passion with which he delivered it, and then the great panel this morning on diversity and inequality, I hope that you will all catch that. And thank you for attending this session. A shout out to Lewis's comment about the makeup of the session might be not quite what we would hope for, but we'll work to build that and share with male colleagues and others. So thank you all for coming, and hope to see you at the next session.